Hey everybody, Dr. Dave, Psychiatry here. Had a patient this morning that caused me to want to jump on the camera today and record a video about a topic that hits some people. This might be a very interesting video for some people, might have no meaning for others. It's a little bit outside of my lane because it's about the process of getting medication as opposed to the ideas and the thought process behind the medication. The question is, patient comes to me today and says, I need my medicine, but I've got to get a prior authorization. So prior authorization is the topic of the video. If you've ever been told that you cannot get your medicine without a prior authorization, that's what we're talking about. So this is not about the mechanism of action of medicines or how they work. This is about what happens when you go to the pharmacy and they say, I'm sorry, you can't get your medicine today. You need a prior authorization. Okay, now when did prior authorization start? And what does the word mean? Prior means before. Authorization means the insurance company is going to pay for your medications. So if you're a cash patient, if you're buying your medicines in cash, this doesn't matter at all. This has only to do with authorization from your insurance carrier, the policy that you own, that covers your medication. If you have that, you may be required at times to have an authorization to get the medicine from the doctor like me. So it's not as easy as I think the medicine's good for you. You agree that it's good for you. I write a prescription, they fill it and everything's fine. No, sometimes there's this thing that happens. And because it's prior to getting the medicine, that's why it's called prior authorization, means your insurance company is agreeing to pay for your medicine. Now, why does that happen? We'll talk about that a little bit in a second, but here's what's happening. If I write a prescription for you, and a lot of times this happens at the beginning of the year, which is part of the reason we're talking about it right now, because at the start of the new year, a lot of times insurance companies require an annual prior authorization, which they will typically cover for 1 year. They will say, okay, for this entire year, we'll allow you to get the medicine that you and the doctor have agreed on, and yes, we'll pay for it. But the prior authorization that has to be redone typically, or gets done the first time, starts like this. I write a prescription, I electronically send it to the pharmacy. The pharmacy then, from their station, sends it to the insurance company to see if it's going to be covered. If it is, they fill the medicine, they take your copay, you get the medicine, you leave. If it comes back prior authorization required, then the pharmacy is not going to give you your medicine at that moment unless you want to pay cash. If you just said, you know what, I'm leaving town for a month and I need it today and it's an extra $50, fine, I'll just take it. Well, or if it's more than $50, or it could be $1,000, don't know what your medicines cost sometimes. It's crazy in today's world. The point is that you do have the option to buy your medicines without your insurance. Insurance doesn't require you to use them, which I think in some sense is a motivation for them to slow things down. Because if you mess up and it's last minute and you got to get your medicine, like the gal today, she said, they could have given me my medicine, but they were going to charge me $49. And I said, well, you don't need to do that. Let's just get the prior authorization. She said, well, what do I do? I said, you don't have to do anything. You don't have to do this. So that's where it all starts. Does the patient think they have to do something? No, the patient doesn't do it. The patient's standing there at the counter and the pharmacist looks at them and says, I'm sorry, you need a prior authorization. Now that's not an instruction for you, the patient, to go do it. That's simply stating the fact that it's not going to get paid for by insurance. So the next thing that happens is the pharmacist sends the information, and I think maybe the insurance company, because if we're contracted with the insurance company, we also get it from them. I could be wrong, but the point is that the information gets transmitted back to us that a prior authorization is required. So then what we do is we go to the clearinghouse, and I have somebody who does this in the office, people that do this in the office. They go to this clearinghouse, the name of it doesn't matter, but it's a website, and they put in the information that's necessary, and that information goes back to the insurance company, and it may include chart notes, rationale for the reason that the patient takes the medicine, a diagnosis that's required by insurance in order to do something which, in some sense, I don't agree with, but it doesn't matter what I agree with because that's what they require. Once we give our clinical information to the insurance company via this clearinghouse, the insurance company then comes back and either says approved or denied. If they say approved, then that information then goes to us and also goes to the pharmacy. And typically, 3, 4, sometimes 7, 10 days later, then the medicine is authorized to be paid for by the insurance company. And at that point, the pharmacist will give your prescription, and hopefully you don't have any more than your normal minimal copay. In other words, you're not paying extra to bypass the prior authorization. If the medication prior authorization is turned down for some reason, most times in my experience, that's because they've got a diagnosis, a DSM diagnosis that they need in their code to make it valid. So the truth is, if they need that and it's valid in our prescription, in our system, then we just provide that to them. But most times that's not the issue, because we're always using, at least in my practice, we're always using the medicine for the purposes that are intended for the patient. I said before a little bit that this is a little bit of a speed bump. And I think in some ways what happens is people get in a rush, or they're late with their medicine and they think, you know what, I'm just gonna handle this myself and I'm gonna bypass the prior authorization. If the pharmacist says to you, hey, it's gonna just cost you $10 and that's worth it to you, fine. But if a pharmacist says, yeah, that's gonna cost you $200, well, you probably wanna wait. I mean, I do when it happens to me as a patient. So the speed bump issue is, I think, really is just part of the process. And unfortunately, it does slow people down. Sometimes I think it's appropriate. Sometimes I think they maybe just use it to do a little bit too much speed bumping. That's my opinion. That's not really a fact. That's really my opinion. But I do see it happening sometimes with pharmacies, and it's something that I sort of don't like it when it happens. As far as what you have to do, the core message is when someone says you need a prior auth, you don't have to do anything. You just need to be patient and wait. If anything, the smart thing to do is to don't wait until the last minute to get your medicine. So for example, today, the gal that I saw, we sent that prescription in. I said, if there's going to be a prior auth, go right now, go today, ask for it. They will make sure the prior authorization is initiated. They'll submit the information to the clearinghouse. The clearinghouse will get back to them, and hopefully within 3, 4, 5, 7 days, you'll be able to get your medicine and you won't incur that $49 expense. That's what I told her today. It's amazing to me that I had to review the prior authorization process myself. I typically don't handle it. As I said before, I have other people that handle that in my office, because it's really just looking at the chart notes and saying, okay, there's the number that belongs here. But it is a problem every time it happens, or that they have the anxiety that they're supposed to do something. So the main message to you, the patient or the family of the patient, is when you hear the word prior authorization, don't panic about that. It's not something that you have to fill out. They're not going to give you pieces of paper and prove that you have to do something. That's all handled between us, the clinical people, the pharmacy, and your insurance company. That's how it's supposed to work. All right? So that's my lecture about prior authorization. Hopefully that reduces some anxiety if that's ever happened to you, and if it happens to you in the future. So that's all I have for today. I'm Dr. Dave Psychiatry. Thanks for coming to see me today.